going to kind of move in with our next rock star speaker, a man who I've had the privilege of knowing for a few years now, erstwhile Karmavir Puraskar awardee, and continues doing the good work. Expert in the field of HIV/AIDS, founder, director of the Touch of Hope Foundation. Seen him personally working with patients, and I think that's real bravery and courage, because it takes a lot of courage to physically remove maggots from a human being, a human being who's alive. I mean, removing maggots from their body. It gives me the creeps even thinking about it, but that takes a lot of courage. I don't know, people in this country think that courage is something which Bollywood heroes have, but that's not courage at all, because you see all the Bollywood heroes were actually kind of paying obeisance to a man who didn't deserve any respect. I'm talking about Bal Thackeray, who died a few days ago. But that's the way our heroes are. Everybody from Amitabh Bachchan to a Salman Khan to a Shah Rukh Khan. But I think what the real courage is when people are doing that real work on the ground. And proud to present Dr. Chinkholal Thanging, founder director of the Touch of Hope Foundation. He's going to speak on the theme of love and care, the tools to overcome the HIV stigma.
Thank you very much. And firstly, as we set up the slides, I would like to thank the team here, the team at the Rex, and also everybody here today at this moment, because it takes a lot of, I would say, time and also sacrificing your work and things like that to be here. So for that, I thank you. And today, I would like to share with you in just 15 minutes about what I have been doing for the last 25 years, working as a doctor, working as an activist, or serving the people who are also called the new untouchables. And as you all know that last year, 2011, 34 million people live in the world today with HIV, and of which last year, 1.7 million people have died. In India, we have more than 2.5 million people infected, and every single day, 7,000 people are getting infected. Billions and multi-billions of dollars are spent around the world, including our country. Crores of rupees are spent to contain this disease, and then take care of those, that are already ill. And then we have achieved a lot today, but we are in one way losing a battle because of not that awareness, information, or drugs are not available. It's available, but we are still losing the battle. Why? Not because of the virus, not because of the disease associated with HIV, but just simply because of something we call stigma. How do we overcome stigma is so important now that at a global level, it's just been almost just 3 years, since an initiative called Fighting Stigma Against HIV, which is now the total and most important barrier in HIV, in the battle of HIV. Now, in the early years, you know that in 1981, 5 gay people were detected with HIV, AIDS. The founder was Michael Gottlieb in Los Angeles. People associated with gay, and then people stigmatized them. And even in a country like the United States, people with AIDS die in the corridors of the hospitals. because of stigma. So that so many people, whether it is church, the community, or the country, or the government, even stigmatize and discriminate them, including our country and many other countries in the world. So at that point of time, the fight was, what is this causing the disease? What is it all about? Ultimately, in 30 years, we learned a lot. But today, it really boils down to stigma. We don't remove stigma with medicine. We don't remove stigma with surgery. We don't remove stigma with some biological thing. We are going to remove stigma only because you would care. If you care, you would. When I first started working with HIV, people with HIV in 1990, people refused to touch them. Doctors refused to touch them. And then the community just would refuse them. The religious group will say, okay, here is the judgment of God to remove scum from the art. So they're very happy in one way that they're going to remove people, then the world will be clean of maybe, corruptors or that time it was drug users, truckers, sex workers. But then ultimately they were all wrong. I moved from working since 1990 in the Northeast dealing with HIV patients. I have seen so much. And I came to Delhi in 1997. And the second day I landed up, I do not know where they knew I had worked for people with HIV. I got a call and said, there's somebody been thrown out from hospital in 9 of the biggest hospitals in Delhi. He was thrown out from AIMS, Safdarjung, RML Hospital, and a lot of other hospitals. So we took him in, and then ultimately using all the leverage we can, including the WHO, we took him to, ultimately put him to AIMS. They threw him out again, and then he was in a small, dirty corner in Safdarjung Hospital where nobody, nurses, doctors even don't go there. I went there, and then I remember one thing. He said, you take me away from here. I said, where can I take you? I don't have a hospital. I don't have a care home right now. I'm just a visitor here in Delhi. He said, it doesn't matter. I would rather die under your care than live. Such was the strong stigma. Such was the discrimination. Such was the guilt people felt, people with HIV. That was just a little thing. Like then, there was a person who has been ignored by doctors. He couldn't find any place to drain an abscess in his thighs. He came to my clinic, and then when I was examining him and touching him, he cried. His tears come rolling down. And I asked, why? Why do the tears roll down? And he said, you touch me. That was the time I really understood the power of touch. And that was also the time when I coined the word for the foundation called the Touch of Home. And there's so many stories I can share about stigma, not only in our country. I work in Pakistan, I work in China, I work in 7 other countries, and then I have seen stigma all around. And the stigma we have today are all the same where there is no cure with technologies. Now, looking at the current scenario, things have changed in terms of stigma and discrimination. Globally, the percentage of HIV has fallen down to 50%, which is really good. But then, as I said, it's still persisting, it's still lingering on. The drugs available in our country and many other countries through the initiative by WHO and the Global Fund and like the PEPFAR, antiretroviral drugs which are unavailable are available now. In India, we have more than 5 lakh people on AIDS care, AIDS treatment. And because we don't see people like a skeleton or dying anymore, that there is complacency. And even though it's there are still a lot of stigma at workplace, and then also with the new drug-resistant form coming, we are seeing a lot more stigma still happening. It's still stigma happening. And then globally also, at all levels, there are laws being enacted so that if anybody discriminate or stigmatize or remove people from workplace or employment and other atrocities against the human rights of that person, they can be prosecuted legally. But that is not really doing a big change because the law are not enforced. And then also, there's the new, one wave has gone. The beginning, there's so much of awareness, so much of prevention message that has gone into the public, into the community, or globally, but that has gone. The hospitals, the hospital who are more aware, who are sensitive to people with HIV are gone. Newer staffs are coming, and newer staffs are again replicating the stigma they have done by hanging like cardboard saying this is HIV, be careful, wear double gloves, wear a mask, as if AIDS is or HIV is going to jump out and catch you. So it's really a sad thing, Now, therefore, I am just but a single person, but I work with a lot of people like Jerry, or like a lot of my friends here, or my team, or you all now, those who are involved with the Rex and the Karmavir. We can all do this together. If one individual can make so much change and influence people, I think we can do a lot. Now, in my work, all the thing I have done is really travel around the world, travel around Delhi, travel around India and other neighboring places, and I really focus my work on healthcare providers and also non-healthcare providers. Healthcare providers is that, interestingly, the healthcare providers are one of the number one place where stigma originate. It originates in the community also because they don't know how it spread, how it doesn't spread. But mostly healthcare workers are guilty of the stigma itself. So just to name a few, in 1998, with my friends, we filed a public interest litigation in the Supreme Court of India to say it's not to find fault, but to find a remedy. We seek the Honorable Court, the Supreme Court of India, to allow us to treat patients in the government hospitals. We didn't tell them, you treat them, but we said that we will come and help you treat them. That's what we started off. Then also, then I had a lot of collection of photographs with, of course, permission from people who are HIV positive. So with the US Embassy in India, we have a photos of hope, where we do it circulate around the consulates in India and also around the country, so that people would know that people who are HIV positive are like you and I. And then we have the Song of Hope, and then we have got the Stay Negative campaign, Love Condom. Then we have also an initiative called Keep Hope Alive. And then we are also working towards another initiative we call the Thinking Positive for Hope. And there are a lot of things we have done. Now, one thing we got to know is that we want to divide. Today we say, these are the corrupt, we are not the corrupt. These are the poor, these are the rich, these are this, these are that, those are the black, these are the white, these are from Bihar, these are from this. But when we talk of something, we talk of a lot about development, we talk about children, we talk about industries, we talk about new things that are going to be built. But if we still divide and say that it's them or us, it is not them or us, it is we. So therefore, we really got to take this to the next level. Now, I do not have much time. I just got 2 minutes. So in 2 minutes, I would like, who are all here, to really look at how are we going to address this. How many of us here have a father? All of us have a father, a mother. How many of us have a brother or a sister? All of us have. Somebody could be that. You love somebody, when you love somebody who is even a drug addict or who is a chronic drunkard or who is even a leper, you learn to love them because you care for them. To ultimately defeat the menace of HIV epidemic, unless you internalize it, you see it as your own, you see it as somebody from your family, unless we do that, we are never going to defeat this. But If we do that, we are going to make a change. Now, just before I close, I would like, this is a simple thing which we have started off, but I would really like this opportunity at this Rex with wonderful people like you, with people who humbles me because of the good work you have been doing in all your chosen professions. But this also is definitely my chosen profession, and it is ours. So what I wanted is, as I close, is that let us take a pledge to conquer stigma. And this is very simple. I want only 30 volunteers from all of us, maybe more, or all of us. I won't say only 30. So the idea is very simple. 30 people, at least a few of us have friends, no? Some may have one, some may have two, some may have 100, and some of us have 5,000 friends in the Facebook. So I want not 5,000, I want not only 100. I want you to have 30 friends only. You spend 30 minutes to 30 friends in 30 days. You make sure your 30 friends speak to 30 friends of their friends for 30 minutes in 30 days. And then you see, 30 days, 30 minutes for 30 people in a month, 900 into 30, 27,000 to 30, 8 lakhs into 30, 24 lakhs. This way, this way, we are going to be able to reach to people. We are going to be able to talk to them in a personal way. People you meet in a movie, people you meet in the bar, people you meet at beer, people you meet at the railway station, people you meet at the standing in the queue in the coffee here outside. Let us take it that one. Let us love and care for people. Yesterday is long gone, tomorrow is yet to come. We have today with us. Let us begin. The longer we delay, the more people will be stigmatized, neglected, and prejudiced. Go give a hug. That's the only way to begin breaking the walls of stigma. Thank you.
Thank you, Dr. Lal. Center stage for the questions and answers. So in a few minutes after we finish the Q&A, we'll break for lunch. And in the aftermath of the Karmavir Puraskar awards that happened last night, a lot of people have not been able to show up in the morning, but they're all coming. They'll probably join us during lunch, so there'll be more people because they all have to also get their Karmavir fellows. After lunch, we're going to have the first talk by Lorraine Aloysius, who's going to also have a small performance built into her talk. And then we have some compelling rock star speakers who shall talk to you. There's Yogesh Kochar from Microsoft. There's Abhishek Bharadwaj, who's working with the homeless through alternative realities. You have Vijay Pratap Singh of Ekgaon Technologies, Sumitra Prasad of the Dorai Foundation, and of course, Dr. Chandra, who's just joined us, who's the father of nutritional immunology and a renowned expert globally. So we'll open the floor for questions and answers with Dr. Lal. Okay.
Yeah, it's a good presentation. I have the experience of working with a live HIV virus for a year as a scientist. There are few facts. HCV is a virus, which spreads the hepatitis. That is more contagious than HIV. And HIV virus, for your information, it dies at 50 degrees Celsius, whereas other bacteria, it takes, like more than 100 degrees Celsius. Even after working directly with live virus, I could even touch the patients with HIV. Even I could talk to them freely. This is what I have done in States. And at smaller level, I could spread the same message what our speaker could do it in a highest level. The same, stigma is very important. And this is what happening like 2,000 years ago when Jesus was here in this world. Leprosy was giving the major social stigma. The same level of stigma is with the HIV these days. So as he said very clearly that, if we start spreading this news, if we get rid of the stigma for these patients, I think so they can be taken care of very well.
Yeah, that's true. That's very true. I think as I had already said, we really need to work this to work on this to really remove stigma, which is really now the #1 barrier, because we got medicines now, though there's no cure, but it's still spreading and ruining lives around the world. So we all really need to address stigma. Thank you.
Yes.
Yeah.
Dr. Amit Saini.
Yes, doctor, that was a nice speech which you gave upon HIP. I just want to tell all the people around here that I've also treated HIV patients, and basically when we do surgeries and all, we don't really ask patients whether they are HIV positive or not. I want to tell patients, people around here, that they're not to be afraid of HIV. HIV virus does not be stable. It kills itself automatically when it comes out in the atmosphere. So when a HIV patient, when we are dealing with a HIV patient and we have blood on our hands, we do not have any cuts, we will not have any disease transmitted to us, because HIV virus does not be stable in the atmosphere itself. That's all.
Thank you, Dr. Saini.
Yeah, thank you. And to add to that, you know, friends who are here, there are the most well-researched about of any virus in the world is HIV. So many people in the world are looking for this virus and, you know, its cure. And then there's so many books on AIDS has been written. There are volumes of it, but it just really boils down to a small cut for us here. HIV spread through, you know, having sexual intercourse with an infected person, or a needle, infected needle or instruments, sharing of that one, a mother to child, and then also from blood transfusion. Blood transfusion and mother to child transmission has really come down. So if we look at that, those who are here, non-medical, don't really to read volumes of it. Just what I said, that's enough. Let's go out there and tell that message, and that will really bring down stigma.
Thank you, Dr. Lal. Yes,
That is-
Anupam. It's the last question we will take, and then you can catch Dr. Lal over lunch.
Dr. Lal, can I have your attention, please?
Yes, thanks.
Right, Dr. Lal, dealing with positive people for quite some time, it all started with you. And I do understand care, support, and most of all, giving the warm hand that you have told us to do for these people have really proved a boon for them. But Dr. Lal, I just wanted to bring one thing to the fore. I've had patients who have come to me when I've been treated at very big hospitals with a lot of cost, money, and shocking to find, even today, when the IVs have been put on them, the HIV board is on there. I've gone and fought, Dr. Lal, for these very people who look up and say, ma'am, even the sweeper doesn't want to come to clean the bedpan. Dr. Lal, I think even doctors who've been trained under you, unfortunately I have to bring this to the fore, are using the HIV/AIDS medal, as I would say, to cheat up positive people who go to them privately. They've been charged double the amount of money because they're positive, and there's some of these doctors who don't know what they're telling the patient about. He has TB, he develops cancer, he has a nodule under his armpits. No, tum jaake marna. And these are the very doctors who've been trained under you, Dr. Lal. It's very unfortunate, very sad, and in fact, this is where the stigma comes. If you and I don't break out of these glass houses that we live in, our patients who are looking forward, Dr. Lal, I remember the man with big maggots who you...
We'll have to make it a little brief, huh?
No, I not. This is one thing I want to take up very, very seriously with Dr.
No, thank
Lal.
you. No, thank you very much.
thank you.
You know, we speak of corruption since, and then we're trying to fight corruption. So definitely this kind of stigma within the system itself is very much there. And a very brief thing was that, you know, I had one of my patients, a 19-year-old boy who got HIV because he's a drug user and he was at home. We've been going for a home visit to treat him at home. One day I got an emergency call. And then, you know, his lung had burst, and then he was having pneumothorax. He would have died in the next 10, 15 minutes when we went to their home. And then ultimately there was nothing at home. So I asked for an IV tube, you know, the infusion tube, and then used a kitchen knife to cut on the muscles and just put the tube inside and put the tube on the bucket and then remove the air that saved his life. And then we patched it up, and then we went to the hospitals. So then the hospitals said they don't have a rubber tube, intercostal tube, which they can use. Ultimately, I know it's wrong because I know it's there. They have been stigmatized and discriminated because he was HIV positive. So then I thought they were joking. Those are my colleagues, 3 doctors and a surgeon. Then they said, no, it's not here. Take him to another hospital. I said, are you joking, or is this for real? If this is for real, I am going to put your names in the newspaper tomorrow. So, in fact, the fight within the healthcare system is very much there. I have seen in so many people taking advantage of patients, say that आपका, you know, शरीर पूरा बीमारी का घर हो गया, आप तो 2 महीना में मर जाएगा. So there are doctors like that who says like that, and then they treat them. So definitely, there's so many stories around the world, but only thing of what you have done or what you have said, it is very much there. And there's hundreds and thousands of stories. But ultimately, as I was telling you, that we got to learn to take it personally, learn to love, learn to care, and that's the only way we will.
Okay. Thank you, Dr. Lal. Jagdish, keep it very brief. One last question, and then we pack up for lunch. Tenzin will have to catch Dr. Lal over lunch here.
Getting mic with so much difficulty is definitely an indicator of success of the meeting. So, yes, Dr. Lal, thanks for the presentation. You are, I think, not only just touch of hope, but touch of passion whenever I hear you. He's a good friend of last 10 years. Just one appeal, because some people are interested in solutions. So, because not everybody is working in the field of HIV, one of the solutions you can provide as an individual is that if you have a vacancy and you are in a position of influence, consider a PLHIV for work. You can shoot an email that these are the things we work together with HIV Atlas and Touch of Hope, and we will send you some resumes, no pressure. We'll not even follow up. If you can take the interview, and we can even sensitize your workforce so that there is no such problem at the workplace. When Naveen was talking, Gulia was about bagging and the child issues. AIDS orphans is a very complicated issue. AIDS orphans do not even have the option of bagging, because again, the workplace stigma at the bagging level is also rampant. So please consider that.
Okay, thank you, Jagdish. Okay, Stanzen, since you've been raising your hand for long, and keep it brief, please.
Okay. Like stigma leads to discrimination, and discrimination leads to exploitation, and exploitation leads to the violation of basic human rights. And whether it's rights to education, health, work, or access. And today we have millions of doctors in the country, and those who are treating the patients like a broken machine. Yeah, okay, they are fixing a broken machine without any compassionate touch. So I believe that Dr. Lal is an inspiration, a role model for many of the doctors, those who are working in the hospital, treat patient with compassion. And I got most of my career I spent in the HIV sector. Once I was in Tamil Nadu and in a village, and there I asked, okay, is there any people living with HIV? Then, okay, after lots of insistence, then they disclosed there's someone. And that person was boycotted from the whole community. Nobody was going to that place, neither their relatives nor their in-laws. And and that person was okay within the four walls of the house. And then I went to that person, and I spent some time.
Stanzil,
I
you'll have
had
to-
tea at that place.
Yes, yeah, you'll have to just get to the
Yeah,
point.
so the crux is, the bottom line is, sometimes the mere information doesn't help to break the stigma in the community. You have to demonstrate, you have to touch the people, then and only then we can create an enabling environment where the people living with HIV can also live a life of their choice. Thank you very much.
Thank you, Stanzil. Any closing words, Dr. Lal?
Yeah. No, that's true. You don't have to be a scientist. You don't have to be, a doctor. You don't have to be even a nurse. You don't have to be. You just got to be a human. You just really need to just sit down. You just got to be there. That's enough. But where are my 30 people? I see more than 30. This is exciting for me. And these 30 or 60 people here know Jerry's email ID or my email ID. Please write to me and we'll take it forward. I think let us begin it here because I'm off to the US tomorrow. I'm speaking on the same subject on stigma in Howard University. I've been invited there. So this is an excellent
In the afternoon, we'll have more people, so we'll do the appeal again. Yeah. Thank you. Thank you, Dr. Lal. Thank you so much for being with us.